It's going to be a short presentation and a snapshot of what MRCP1 is and how to get started, how to prepare, what are the strategies. So I've broken down into the strategies, expectations of a good candidate, what is expected out of the exam, what are the pitfalls, so certain ways where people go wrong, where people cannot pass the exam on the first attempt. And I'll end by giving some sample questions which are asked, which are best of five, one answer best of five, and some sample questions which are asked in the MRCP exam. And towards the end, we'll leave the call open for any Q and A's. So feel free to ask any question if you want to stop me and just um, give a cue or interrupt me with any other question. Please feel free to do that. Without further ado, let's get started. Yeah. So this is our topic, how to start MRCP1 preparation. We will go through the thing first. Okay. So talking about the structure and the syllabus of the exam. So the structure is very clear. What MRCP Part 1 is, it a three-step exam for MRCPs, Part 1, Part 2, and the PACES exam. And that's what it's called. It's MRCP Part 1, MRCP Part 2, and MRCP PACES. So level 1 is the entry-level exam, a specialist level exam for doctors who have minimum 12 months of postgraduate experience in medical field. Now, 12 months postgraduate means postgraduate, that you have 12 months of experience after your internship has elapsed. They don't want 12 months of experience after you've done your specialty or your postgraduate training back in home country. They just demand 12 months experience. And why I'm stating this part is because when you apply for the MRCP1 exam or when you sign up for the RCP account, they want you to submit certain documents, which I'll talk to you about. They want you to submit your experience certificate and your primary medical qualification, which is your MBBS or degree certificate, which has to be notarized. The MRCP exam is an acquisition of your medical knowledge, your skills, your behavior, as per the UK STC or the Specialty Training Curriculum for core medical training or IMT. It used to, so medicine was earlier called as CMT, now it's called as IMT 1, 2, and 3. And that's the entry level. That's the exam which you can give either before entering IMT or after you've finished IMT, or if you are in any other country in India, Pakistan, Sri Lanka, Bangladesh, etc. The purpose of level part 1 exam is to test the knowledge and understanding of common disorders as outlined by the UK curriculum. Giving you a simple example, such as diabetic ketoacidosis guidelines, you may be following some other guidelines in Pakistan, India, Bangladesh, but UK has different guidelines, and you need to follow guidelines as per that, as per the curriculum, as per the UK curriculum, as per NICE guidelines, as we call it. So every topic has a different guidelines. Your respiratory medicine has guidelines followed by British Thoracic Society or BTS guidelines. Cardiology follows a bit of UK guidelines, a bit of European Society of Cardiology (ESC) guidelines. And all of these guidelines are collated in our structure, in our presentations, and also one question bank, which I'm going to talk to you about. So the structure, it's a 1 day exam. There are two exam, 3 hours apart, 100 multiple choice question, best of one. There's only best of five. So there's one answer which is going to be right, not multiple um choice answer. Two paper, 3 hours each will be dispersed by a 1 hour break. So it'll be a morning shift and an afternoon shift. Both hundred questions, very similar pattern. Usually there are no images. The images are mostly asked in MRCP part 2. A lot of dermatology, ophthalmology, imaging, and etc. are asked, but not in part 1. Part 1 has shorter stems may contain blood report findings such as the peripheral blood smear, electrolytes, LFT, RFT, CPC findings. ECG's findings are there, but usually an ECG is not given. So suppose you want to diagnose, for example, a supraventricular tachycardia versus narrow supraventricular tachycardia, let's say a broad base and a narrow one. Usually, ECG will not be given to differentiate between them. An ECG finding will be given, or ECG findings is suspicious of a proximal supraventricular tachycardia. What is going to be your likely management, either initial or the best management, and that is what MRCP1 tests you. It doesn't test you based on interpret the ECG or interpret the fundoscopy. That's all the MRCP Part 2 content. It's a computer-based exam. When I gave it, it was paper-based, and I think soon after that they upgraded to computer-based exam at a center which is available widely, and you can make the booking streamline via the RCP account. So for 2025, these are the three dates, okay, available. There are usually 4 dates in a year. They haven't yet released the October or the November diet dates. The first date, um, there are a certain dates. So this was 18 November 2024 dates. For 2025, sorry, I beg your pardon, there's a 2022nd January 2025 date. There's a 14th May 2025 date. There is 17th September 2025 date. And these are all the dates which have come up on the RCB website yet. They haven't released any dates for October or November yet. Usually there are 4 exams a year, hoping that there will be again 4 exams next year, but we do not know. As of now, there are only 3 dates on the websites. For further details, you can always email RCPs asking whether there will be any October or November dates for 2025, and that can make it clearer and just will help you structure your preparation better depending on when you want to start. A very important part, timeline. Either you're working or you're without work. And I'll give you an example of how I did it. So with work, ideally 6 to 7 months is more than enough with 4 to 5 hours of study per day. That is following our lectures and corroborating that with with question and answers and just making notes out of that. Without work, if you're off work, if taking a break for whatever reasons, I think 3 to 4 months is more than enough. Do not drag it beyond that. How I did it with, I believe, 5 months of full-time work. I was working full-time and working and studying 5 months with that. And the last 15 days I took off for my MRs, just having a very rapid fire in the last 15 days of doing mocks, doing revision, doing multiple revisions, and then giving the exam. This was my experience. There are certain steps of preparation. Subscribing to a course is very important as what we will be offering, and there'll be multiple types of courses. A question bank, if you want to go along with it. PassMed is a good question bank which you can follow along with the course. So how it'll help is you can make notes out of our course, and then you can use those notes to solve questions on the PassMed website, and you can do multiple passes of PassMed websites. A lot of it would be very derivative of the NICE guidelines, the British guidelines, but it would be excellent if you use our strategies and apply to the PassMed question bank and do it multiple times. First pass reading and note makings of core subjects, and these are the core subjects. And what I mean by core subjects is that they ask nearly more than 14 to 15 questions per subject of these long subjects. So cardiology is tested widely. They ask about 15, 16 questions on the paper on under cardiology. Clinical sciences, they ask about 25 to 30 questions. Now, clinical sciences comprises of your anatomy, a bit of physiology, a bit of biochemistry, a bit of ethics, a lot of biostatistics, and some amount of pharmacology here and there. So a lot of first and second year and a bit of integrated final year knowledge as well, mechanism of action, side effect profile, etc., etc. Pharmacology and toxicology as well. A lot of forensic medicine is asked, about 10 to 14 questions. Endocrinology and diabetes, they do ask anywhere between 14 to 16 questions in that. Neurology is tested widely. Infectious disease, again, often 15, 16 questions are asked on that topic. Really, they love infectious diseases. Renal medicine, they love creatinine, they love testing electrolytes, they love testing and asking interpretation of electrolytes, using electrolytes and urine findings to differentiate between acute, chronic, pre-renal or post-renal causes, widely asked. And gastroenterology. These are some of the long subjects that I would say which you have to target first. And this is how, and we will be teaching them first as well. Long questions are essentially which ask about 15 questions or more on each of the paper. So each of the paper means on each of the MRCP exam, which comprises both the papers. Short subjects are the following, which where less than 10 questions are asked: oncology, ophthalmology, palliative medicine, dermat, rheumatology, psychiatry. These are short subjects, so the key is to practice more questions than theoretical content, less of theory and doing just more of practice from the theory. Because I'll tell you what, Very similar questions from what you do from our practice, from our course will be asked on the exam. Very similar, they have their similar core topics which are tested, and they just keep asking different questions on those topics. Another um, good strategy of navigating short subjects is by revising more summaries, doing a lot of summaries of these short topics, and doing rapid second pass reading with reviewing of last 1 year recalls. Another very crucial step of preparation because you've done your first pass reading from our course and by solving questions, but you need to go ahead with the second pass reading so that the information you have learned you can consolidate and you know that where you went wrong in the first pass and you can make it correct in the second pass. For example, if you're solving a cardiology question and there is a valvular heart disease question that you got wrong. So for example, a valvular heart disease answer which you got wrong in the first pass, which you probably didn't know. Maybe vancomycin was supposed to be used, but you picked on benzyl penicillin, and you go through the guidelines and you go through our notes and see why you want to have to use one medication instead of the other. And when you do it the second time, you revise this again, those short summaries or notes, and the second time you perhaps get it right. And that's the whole idea of doing second and third pass of the course, the question banks, because you want to be doing the same topics essentially over and over again till the point where you answer those questions under that topic correctly. Last 1 month revision of your notes is very important and rectifying those mistakes. Again, kneeling from those previous point only, how important it is to rectify for those mistakes which you made on the first month revision. Last 15-20 days, what I did was when I was off work, you consolidated by doing 20-25 mock exams, doing a lot of mock exams. The last 1 month has to be used just to do mock exams. So 3 hour mock exams, you can essentially do one. I used to do two a day, maybe even three on an off day, and just doing a feedback, reviewing all the answers, ensuring what answers you got wrong and just putting down on the notes would be excellent way to revise those mocks. That is basically doing a reviewing of your mock exams because you want to know where you went wrong and why you're repeatedly going wrong on a question. I used to mark one question wrong repeatedly on 8, 9, 10 consecutive mocks till I think on the 12th or 13th mock I marked that question correct. So that's the importance of doing mocks over and over again and reviewing those answers. Very important. Do not go into the exam without giving 10 marks at least. It is an essential, it is quintessential for you to pass the exam. And when you do mocks from wherever you do it, from us or from the question banks, target a rough range of about 70%. That will be excellent. And that was what I was targeting. In terms of attempts, so candidates are permitted a maximum of 6 attempts for the MRCP exam. After 6 attempts, there can be exceptions, but you need to write to the RCP. You need to ensure why you're eligible for a 6 attempt, give an explanation, probably get it notarized. It's an onerous task, and I do not recommend any one of you to go through it. Ideally, it's a four, you can pass in the first attempt, but it's just for information that you can give up to 6 attempts of the six. So this is when you are eligible and when how you become eligible by signing up for an account, by submitting a copy of your primary medical qualification. This would be your MBBS. Submitting a copy and it should be notarized by by either a justice person, a defense person, or a lawyer or a notary. It has to be notarized and submitted to this email. It's also mentioned on the website what you're supposed to do. If it's not in English, you need to get it translated into English. Again, get it notarized by the lawyer that this is an original copy of your medical degree and it has been translated to English and you submit it. So all of this happens when you create an account. Once you create an account and once you create an account, this email will pop up and you are asked to submit your medical qualification to this email. Once you submit your medical qualification to this email, they will respond to you. Okay, now you are eligible to apply for the MRCP1 exam. Please log into your RCP account and pay the fees for MRCP1 exam. And this is how you go about it. Results and marks, it's a pass and fail exam based on the scorecard. You only need a pass essentially. Doesn't matter, the marks don't matter. And as it is, it's based on equating. So minimum score essentially is between 450 to 480 and I don't know how they target it, but how they calculate it, but it's based on equating, which means essentially it's a scoring system. It depends on how hard your exam was, how hard that particular question was. If you've answered a hard question correctly, you will probably score higher marks than answering a simple question correctly because it is very specific based on the question and based on how the exam was, whether the exam diet was difficult from the last diet, and how your competitors or your peers have performed. So it's just equating system. I would not want you to beat your head around it. All you have to do is if you target about a 65-70% on your mock exams and do the course well in terms of revision, twice or thrice revision, you should be all right. Expectations of a good candidate, delivering two components, knowledge as well as delivery. You have to place close attention to the stem. What is asked? Now, a question is framed as a whole question, and then in the last, they ask, what is the initial most treatment, or what is the best treatment, or which of them could not be the diagnosis? So, you need to focus on these buzzwords. What is mentioned? Is it initial most? Is it best? Is it what is not to be included? A lot of these are very, very important pointers. You can make mistakes. You can make mistakes. Let's say, for an example, best treatment is asked, and there are a lot of options. Out of this, one of the options is initial treatment, which could also be right. But you need to focus back on the question that what was asked. Was it the best treatment? Was it the initial most treatment was asked? What was are they asking about what the diagnosis is or what cannot be a diagnosis or what can be overruled? For example, they'll ask about which of the following is not a neurodegenerative disease. They'll ask about Parkinson, dementia, Lewy body, etc., Wilson's disease, and there'll be an autoimmune encephalitis in the option. And you know that you have the question as the question was asked, which of this is not a neurodegenerative? And you know you have to click on autoimmune encephalitis for that. So this is how paying close attention matters. Demonstrating ability to shift from one subtopic in medicine to another, which means that that means that you should be seamless if you're solving, let's say, one ophthalmology question and the second question is a cardiology and endocrinology question, you're able to shift from the knowledge very easily. You're able to guide your mind and you're able to revise that topic very well in your brain so that you can apply it. You're encountering two questions, clinical sciences, and the third question is on neurology. You should be able to break your brains and have that focus that okay, the third I have to solve it. I have to recall and recapitulate the neurology knowledge which I learned and the neurology questions which I solved and solve it accordingly. Because the questions are going to be jumbled, the questions are going to be mixed, and it's up to you or how you revised, how you've studied, that will give you this ability. Nobody can teach you this ability of you solving MCQ exam of MCQ questions and exams. Doing everything within time, poor management in running out of time is big red flag because I believe it's mandatory to solve all the 200 questions. If you do not solve all the 200 questions, they will not be able to score you. It used to be around 2 years ago. It's a bit different now, but they still haven't mentioned it on the website that whether you need to solve 200 questions or not. Another big red flag, another problem with time management is missing out on the questions which can be easily solvable. You tend to spend a lot of time in the question where two, three answers are miss two, three answers could be the answer. But in that process, you are actually missing out on the question which you can easily solve. So the key is to, if you are not able to navigate through those options, just flag the question. And if you flag it, of all the questions, it will automatically flagged in purple. So you'll not need to remember which question I have flagged. You'll have a paper anyway with you. So you can always go back to the question and think again. But in that flow, do not miss out on solving the subsequent questions because you will lose out on time. 100 questions within 3 hours looks doable, but when you get into the questions and when the questions, the options start to seem very similar and confusing, that is when a lot of time is used up. Scoring of an average 70% on mock exams would be excellent. Not having recall bias in the sense that if you encounter a question, you know that probably you encountered a similar question on the mock exam or the same question on the mock exam a few days ago and just going ahead with marking it. But pay very, very good emphasis on what the question has asked. The other question may have been very same to the question you solved in your mock exam, but they might just ask which of this is not the treatment or not the diagnosis. That is where you go wrong. That is where you have to see the question thoroughly. After my MRCP, I spoke with a lot of candidates. A lot of candidates were confused between the options. A lot of candidates overlooked this last part of what they were asking, whether they were asking the right treatment where they're asking the treatment which is not to be used here. And that is where you need to focus. And again, a skill which only you can learn by solving more questions and revising over and over again. Because this one can only be answered if you know the knowledge, if you have the knowledge base, and you know that this treatment or this investigation is not performed in this diagnosis. This is a berserk investigation. Definitely, this is the answer if they have asked which of this is not to be used. Pitfalls, that is where doctors go wrong. This is lack of accuracy and identification of findings, sometimes not able to interpret findings. For example, a lot of anemias differentiating between iron deficiency anemia versus aplastic anemia versus hemolytic anemias. If you do not know it, you'll not be able to solve it. Leaving short subjects or subtopics of a long subject during preparation, which means that either you left oncology or palliative medicine completely, considering it was a short subject, or you left a very important subtopic of a main subject, such as you have left out on valvular heart disease under cardiology. This is a big red flag. Do not ever make that mistake. A lot of questions are asked on those subtopic, and do not leave a short subject as well, because if you study short subjects well, you automatically, and they are very scoring, each one of them, you can automatically answer 5 or 10 questions correctly on the exam. And that makes a major difference. Flagging and leaving more than 20 questions on any of the papers. So ideally endeavor to not leave more than 20 questions on the first 100 attempt. Flag questions, but make sure you're not flagging more than 20 questions. If you're flagging more than 20, 25 questions, you know that you have to get back to a lot of questions again. You'll have to rethink your diagnosis, rethink your investigations, just recapitulate a lot of your memory, and that will just waste a lot of your time. So ideally, whatever you think is your gut instinct feeling, whatever you think is right, mark them, but do not go ahead with flagging a lot of questions. That will just make you more anxious towards the last half an hour or 1 hour of the exam. Even if you flag 25 questions, make sure you give yourself a good 45 minutes to 1 hour to answer them in the end. Because you need to again think on these questions, you need to eliminate one option as compared to two options, which will take time. Not doing enough questions, not cannot emphasize enough, not doing enough questions from a course, not doing enough questions from the question bank, not doing enough questions of a particular subtopic which is asked. Infectious disease, they ask a lot of infectious disease, they ask a lot of meningitis, and if you've not done enough questions of meningitis, you'll not be able to differentiate whether this meningitis was caused by listeria or whether this meningitis was caused by Haemophilus influenza. Running out of time, this again goes back to the questions. If you flagged a lot of questions, you will run out of time, or you will just answer questions left, right, and center because you're running out of time. Lack of revision, another big pitfall. You've done one pass. I would suggest you to do multiple passes of a question bank of a subject so that you can answer it effectively. And lack of revision is also reflects on your mock exam scores. If your mock exam scores are not consistently improving, that means something is lagging in your revision path. Not simplifying your last 15 days revision. Your last 15, 16-day revision have to be very solid, very structured. You need to have those notes or those slides or whatever in place so that you know that if I'm revising neurology, I have this set of notes here, and I'm not going to look past any such notes. So I have this slide here on my desktop, and I'm not going to look past that at all. And that has to be the key because you need to streamline all your subjects. You may be doing neurology from certain place, but your cardiology is from several books, and you've made down notes. But in the end, if you don't have those solid notes to revise from, you will struggle with questions. Heavily relying on recalls, I've already covered it, what it means, and falling prey to biases. Do not do that. From the mock exam, you had a similar question, which the answer was listeria meningitis. It could be a possibility that I've asked a very similar question on your exam diet as well, but the answer would not be listeria meningitis. Look through it, sift through the questions, what was asked. Was it asked what is the likely diagnosis? Was it asked what is the likely organism? Or was it asked which of the organisms cannot cause this kind of meningitis? And they ask these questions a lot, which is why people spend a lot of time in the just doing a question on the MRCP1 exam. Because the questions are smaller, the stems are smaller. MRCP2 have very long stems with all the pathological biochemical imaging findings, but not so much in MRCP1. MRCP1 tends to confuse you with these questions which they ask. And that's what you have to strengthen and not make mistakes there. Some of the high yield tips, I've just summarized, I believe, four very high yield tips which you need to ace the exam. Understanding the exam format and content, which we will help you with. And you can also refer to the website for the content is, what the exam format is, what kind of questions are asked, and how the options are tailored. They usually ask, they ask all forms of theory. They ask about mechanism of action. They ask about side effects. They ask about most likely diagnosis. They ask about investigations modality. They ask about examination findings. They can give you a patient of multiple sclerosis, and they might ask what is the most relevant examination finding in this middle-aged woman with multiple sclerosis, and there'll be a lot of options. So all of that is tested. Practice is very crucial. Practicing a lot of MCQs and practicing MCQs within the stipulated time limit, which will give you those exam pattern when you're solving MCQs within those 3 hours or 3.5 hours. That will stress you to go beyond and will help you with your MCQ skills as well. Practice, practice, and practice. Revision is essential. Going through notes from the slides we've prepared to solving questions. Like I've already told you the importance of second pass and third pass revision. And a good revision in the last 15 days, that is structured revision, a very structured revision strategy in the last 15 days will help you solve 5, 10 questions correctly on the exam. And that makes a major boost to your score and can just elevate you from a fail to a pass, and I just push you from that borderline fail to an easy pass. If you revise well, if you do your short subjects really well. Engaging in study groups and peer discussion is very important, which is why we have those groups where we engage you with questions and uh, just urge you to answer, urge you to answer them, because studying in isolation can be difficult. If you have doubts, you don't know who to turn out to. And if you have peers who are studying at the same pace as you, giving the exam at the same date as you can always practice with them. You can always practice questions with them. You can share your mock scores with one another and just have this very healthy competitive balance so that you both, and whoever, it can be one, it can be two, it can be 10 of you, can really succeed on the exam. It's about learning those strategies that you have and just imparting them to the other. One person may be very strong with palliative medicine, the other one will be very strong with, let's say, ophthalmology, and both of you can teach those high yield questions of the respective subject, which will just save you both the time and help you answer questions correctly on the exam, and that is the key. I've just formulated some sample questions, and this is going to be my few of the concluding slides of what kind of sample questions they asked in the MRCP one. So I'll just let you go through it. Just read it. It's an endocrinology. So I believe, yeah, it's an endocrinology question. So they have mentioned past history, they have mentioned their medication history, and they have thyroid findings here. As you can see, this seems like a case of hypothyroidism because the T4 is low and the TSH is elevated. Let's go to the options. So these are the options, and the right option is option B, that is advising patients to take iron tablets at least 4 hours apart from the levothyroxine. So over here, it does mention that she's attending with fatigue and constipation. She is already diagnosed with hypothyroidism for which she's on levothyroxine, and you want to find out what's the cause of fatigue and constipation in this young middle-aged woman. She suffers from menorrhagia, that's a big history, and menorrhagia is one of the important causes of iron deficiency anemia in a young female or a middle-aged female who is on menses and who's having menorrhagia, amenometrorrhagia, and you decide to give iron tablets. And the key is to space out your iron tablets on levothyroxine. Very practical situation. A lot of us may be going through that, and because it reduces absorption, that is why you're supposed to do it 4 hours apart. Even calcium supplements, for that matter, have to be given about a few hours apart from levothyroxine, not to be given with levothyroxine. The second question, this is on infectious diseases. I want you to give it a read, and they've asked about the natural reservoir of this virus. The virus is Lassa virus here. Classic findings of viral hemorrhagic fever, so fever, headache, sore throat, history of travel to an African country. What is the natural reservoir? Again, a very theoretical question. It's rats. Lassa virus, a notifiable condition, a cause of viral hemorrhagic fever. have its reservoir in rats. This one is a image, although they do not ask image in MRCP1, but this is a very, very high yield image and a very high yield diagnosis. And in our lectures, we will have images here and there, which will help you, just have a good base on that topic. That will further help you in MRCP2 as well. I want you to go through this image and then we'll go through the these are the questions. Yes, I heard someone. I did hear someone with retinitis pigmentosa, I believe.
আচ্ছা আসতেছে আমি আর না পিছার
Yeah,
এটা খাইতে দাও
it's retinitis pigmentosa. It has bone spicule configuration, hyperpigmented area, which looks like a horse spindle. It's here, and it's a classic fundoscopic finding in retinitis pigmentosa. I believe one of the last questions, what is the gold standard management for severe persistent respiratory distress in motor neuron disease patients? So pay emphasis on what's asked. If they have asked about gold standard management, that is what is the best standard modality of treatment. These are the options: repositioning, morphine, non-invasive ventilation, tracheostomy, intubation, ventilation. And the answer is NIV or non-invasive ventilation. Now, NIV such as CPAP or BiPAP are gold standard and critical treatment options for MND patients. If they ask about initial most management, then probably option one would have been right. But they've asked about the gold standard, the best management, and which is NIV. Intubation is never performed in MND patients. I beg your pardon, this is the last question, and this is what they also ask. Choose the correct ABG or arterial blood gas findings in a patient with ALS, with chronic shortness of breath. 1. pH is high, PCO2, which is partial pressure oxygen low, PCO2 is high, HCO3 is low, P stands for partial pressure. Second, pH is low, partial pressure oxygen is low, CO2 and HCO3 are high. Third, everything is low. Fourth, everything is normal. Fifth, everything is high. A very theoretical finding, as you know, in ALS, which is MND patients, the classic finding is respiratory failure type 2. And in respiratory failure type 2, we have low partial pressure of oxygen and high partial pressure of carbon dioxide. And naturally, if you're compensating for the high carbon dioxide, HCO3 will also be high. So this is the classic vignette of an ABG finding in motor neuron disease patient. So this was all about it. Just wanted to end it with very high yield MRCP1. Let's give you a format and a sample of what kind of questions are asked on the MRCP. And this is what we will cover in our course. Our MRCP Part 1 preparatory course will have uh, a lot of theoretical parts, but we will also cover in the form of questions that we ask question, answer, and then we cover a theoretical aspect of that. For example, if we are discussing, let's say, pharmacology, we discuss questions in pharmacology, and then we have answers, and from there we'll talk about what the specific drugs mechanism of action is, what the side effect profile is, etc., etc. And this is how we will cover the MRCP1 preparatory course, which we divide into several sub-subjects. We'll have session-wise, we'll have a session per week, and you all will be given the outline of the preparatory course. And we have divided subjects with the activities on the group as well, with daily activities on the group where questions will be mentioned, and those questions will also be covered uh, on our PowerPoint where we will discuss about theory. So there'll be two formats. Either we discuss just theory in the form of summaries, or we discuss theory in the form of questions. So that way you will learn the theoretical part by answering the right answer on the PowerPoint presentation. Shreya on the chat box has asked me if the reference range will be provided in the exam. Yes, the reference ranges will be provided on the exam. You will have a question, and on the side you will have the reference range in a bracket. On the paper part, some question they don't provide it. Some suppose like if you are doing a potassium or if you're doing a sodium, where it's very self-explanatory that the potassium range is between 3.5 to 4.5, and the sodium is between 135 to 145. But the reference ranges of hemoglobin, etc., everything will be provided on the exam. This was all about it. I tried to cover all of it on the preparation part for the MRCP1. I hope this was useful, informative, educational, and helps you solve a lot of questions and just get on board with our course, and which will further handhold and guide you depending on what exam diet you want to give. Very good focus on the timelines. I want you to align the timeline based on your personal circumstances, where you are when you can give the exam, and do sign in for a course. Thank you so much, guys. This was all about it. If you have any more questions, just feel free to drop it in the chat box, and I'll get back to you. Thank you. Okay, tips. Very whimsical and interesting question. How to remember everything we study? So what I used to do, I used to write down everything I used to study. So if I'm studying cardiology, I used to divide my cardiology into various topics, valvular heart disease, cardiomyopathies, arrhythmias, congenital heart disease, and just put bullet notes on it. And sometimes used to highlight on in red as to what and where I'm going wrong and what questions I'm attempting wrong, and just keep doing it over and over again. That's where your multiple passes of a question bank and just multiple revision of our courses will help. Will help you consolidate that knowledge to the point where you're solving MCQs a bit more effortlessly. Yes, mock exams and past tests are not real, but they are a good representation of how the exam is. That's correct. Yes, even we have our mocks, which should be a very good reflection of the exams. Starting preparation, we start with our course, simultaneously have the notes copy with you or subscribe to the question bank along with our course so that whatever you learn and read from a course, you can apply on the question bank. MRCP Ireland preparations is similar. The pattern is a bit different. MRCP Ireland asks more of biostatistics, more of clinical sciences question, a bit more basic, not very high-yield medicine, but they have the similar steps and the preparation is also similar. And I believe MRCP Ireland, MRCPI, you can give from your own house, like sitting on a desktop with good connection, and you can give it that way.